Dr. Jennifer Dilts. I'm a pediatrician and a mom to 3 girls. I've wanted to be a pediatrician since I was 12 years old. I love babies, I love kids, I love the fun and the energy that they bring to any situation. I've always thought that being a pediatrician is the best job in the world, and I still do. I became a mom about a year after finishing my training, which included 4 years of medical school and 3 years of pediatric residency at a top children's hospital. It wasn't until I cared for my own child that I realized how little I knew about pain. Shockingly, I wasn't alone. The average medical school student gets less than 10 hours of pain education in all of medical school. As a new mom and a pediatrician, I will never forget how helpless and wrong it felt to hold my own child down for her shots. I knew that there had to be a better way. Years later, while working in an urgent care center, I routinely cared for kids who needed procedures like stitches, blood draws, and IVs. I remember suturing a child's cut while he cried and thrashed as nurses held him down. His parents stood helpless in the corner, crying themselves. The scene was common and traumatizing for everyone involved. Again, I knew that there had to be a better way. So I started asking questions and digging into the research. I discovered that there are decades of evidence on strategies that can make a huge difference. Simple changes that gave kids and parents more comfort and more control. I just had never been taught them. I started a pain and comfort committee at my urgent care. We began using numbing cream before needle pokes and comfort positioning so that kids could sit on their parents' laps during a procedure instead of being restrained. Everything improved for the kids, for their parents, and for me as their doctor. I also put these strategies to use as a mom. Taking my youngest child to the doctor to get her shots felt so much better. Around this time, I was working in my hospital's headache clinic, caring for kids and teens with chronic pain. Many of them were in pain every day, missing out on school and life. It was hard to explain the complexity of pain in ways that families could understand, even though I knew that knowledge was crucial. Then I met Dr. Jody Thomas, the founder of the Meg Foundation, at a conference. When I first saw the Meg Foundation's website, my jaw dropped. I had never seen resources like this before. Kid-friendly tools that are free and have amazing illustrations, and they focus not only on just information, but on advocacy and action. Using them in my practice changed how I could help patients, and it gave me hope. I soon got involved as a Meg Foundation board member. I also got to experience how the Meg Foundation's resources could help me as a mom. One of my daughters spent a lot of time in the hospital preparing for her first of 3 major surgeries. Watching your child get poked repeatedly is never easy, but this time we had tools. She learned how to advocate for herself, and we both felt more in control. What could have been traumatic instead felt like she conquered a challenge. I devote so much time and energy to the Meg Foundation because I know that our tools and our resources are life-changing. I know that as a parent and as a pediatrician, the work we are doing here at the Meg Foundation matters. Pain impacts all of us. The Meg Foundation is taking what I was trying to do in my own clinic, and we're having an impact on a truly global scale. I became board chair because I know that together we don't just change pain for my own patients or for my own children. Instead, we can transform the experiences of every child and every family. Can you think of anything more powerful than preventing a child's suffering?